I'm not used to that and I don't like it. But hi, everybody. So Kelley Gunter is here, and we're glad everyone is joining us. This is for those of you joining live. If at the bottom of your screen you'll see Q&A, and you're welcome to ask questions. Kelley's going to present for a bit, and then you can ask your questions about the information that she's sharing, or just in general. She's a wealth of knowledge. She wrote, and I should have grabbed it, but I was running to my computer. You've got such a pretty face. She'll tell you more about herself too, but I've sent a number of people who have struggled with, body image, food issues, etc., to her. So if any of those kind of things have been in your pain circle, shall we say, please keep in mind she's got groups and everything. Binge Free Babes is the one that I always think of. So she's got that group, but is a great support. So anyway, I'm going to shut up. I'm going to turn it over to Kelley.
Okay. I'm glad. I'm so thankful to be back, Timmy. I was so upset to miss too, but I was at the doctor recently and I was waiting my turn in line, and I saw this woman and she's looking over at her little boy, and he's digging furiously through this big box. And, she said, "Did you find your glove yet?" And he's like, "No, not yet, Mom, but I'm going to find it." And so I look over, and the box he's in is this big box that says the lost and found. And so, it struck me. I thought it was strangely odd, all of a sudden, for the first time in my life, that the lost and found are contained in the same box. I mean, I just thought they're kind of polar opposites, but yet they're in the same box. And so I was thinking about this for a minute, just really processing it like I do. And all of a sudden, the little boy just starts screaming again, super happy. He's like, "I found it, I found it." And he looks over at me. We have this eye contact, and he says, "My mom didn't think I'd find it, but I found it." And, he's just super happy about that. And it just warmed my heart. And in that moment, I just started thinking, each one of us, every single one of us probably have that lost and found box in our soul, that private place within us that no one else on earth ever gains access to. So I'm sitting there and I'm thinking that, and I'm like, what's in there? What's in my box? What's contained in there? Broken dreams, broken promises, broken parts of me that I never acknowledged, shame, maybe things that were so powerful that I couldn't even whisper them out loud. I think about other people and they talk about the ghosts of the person they think they should have become. And I think it's different for each one of us. But what is in there is so powerful because it gives us a deep, deep question to ask ourselves. And so I'm going to get to that question. But the rest of the way, I'm walking to my car. And Tammy, you know how I am. I'm a deep thinker. So I'm just thinking about this. I'm thinking about the little boy. I'm thinking about the blue glove. And I just thought to myself, I had to do the exact same thing. And I think we've all had to do the same thing. That very place that we lost ourselves, the place that we used addictions to try to escape, the place that holds the pain, the abuse, the shame, all of the secrets that we couldn't even whisper to another soul, all of that unhealed trauma, that's where we have to go in order to heal. And the situations that have happened to us, the things that we have most wanted to avoid, are the exact ones that we have to give our undivided attention to. And honestly, who would want to? Who would want to dig into all that pain? Why would you want to open up wounds of the worst things that ever happened to you and things that happened so long ago? I kind of call it the swampland of our soul. And as messy as it gets, inside that swampland of our soul, that's where the healing that we need to do, and the key to that healing resides in that swampland. So how do we actually do it though? How do we sort through that box? And that's what I'm going to talk about today and for the next few months. All the things we can do to accomplish that. For today though, I'm going to talk about something that I've talked about it a little bit in the past, but you're going to see a tail go by probably. My dog, my Robbie just walked by. But all the things we've talked about in the past, I've talked about in the past about grief. And I talked about all the different things that is associated with our grief. And, grief has a powerful grip on us. And the thing is, what I haven't talked about is grieving and mourning. And a lot of people think that they're the same thing. They think that the terms are interchangeable, but they're not. They're actually incredibly different. And in fact, without one, you get stuck in the other. An appropriate active healing is such a powerful piece of recovery that we need to understand the difference between the two. And then we need to know how to incorporate both of them into our healing journey. A lot of people in recovery think that they don't have anything to grieve. But the truth is, most of us have some type of trauma in our backgrounds. And if you have trauma, there is always something to grieve and something to mourn. The first step is recognizing that trauma. A lot of people think, well, I have no trauma. We have to remember that trauma isn't necessarily physical or sexual abuse. It can be neglect. It can be the loss of a parent, whether through death or divorce. It can be witnessing domestic violence or physical violence. Maybe as a child, you saw somebody get beaten up in the street. Maybe you were in a bad car crash or you witnessed one. Here's one that a lot of people don't recognize. Growing up in a household with a family member who is mentally ill can be very traumatic. Another piece that makes this difficult is that most of us didn't even entertain the concept of healing until we were well into our adulthood. And this is where recognizing trauma can be tricky, because in many cases, experiences that are extremely traumatic for children would be much less traumatic for adults. So as adults, when we are looking back, we are quick to overlook things that today we don't see as traumatic. But it's important to remember two things here. Children are limited in their ability to make contextual inferences that would allow them to process their experiences more effectively. And so lacking that frame of reference, for a child to make sense of a traumatic experience only makes the effects of trauma more likely to linger longer. So as an adult, we can process those things. We could look at it and we could make sense out of it. But as a child, our minds and our brains aren't there yet. And so we aren't able to process it when we're little. And so that trauma lingers and it stays put and it develops those pathways in the brain that makes it very, very difficult to be able to heal at that point. And the second thing is that kids rely on their loved ones for support during difficult and painful times. But when a child's loved ones are the source of that abuse or the source of the neglect or the trauma, family support is not an option. And that in itself is traumatic. And the question for many people is, but what do I have to grieve? I may have gone through this. I may have had those things, but what do I have to grieve? And the thing is, in healing from the sexual abuse that I suffered for many years in my own home at the hands of my older brothers, I had many things to grieve. I had to grieve the loss of not just my innocence, but I had to grieve the family that I presented to the world, because that family never existed. The childhood I wished I had never happened, and I had to grieve that. It's interesting because when I spoke with older relatives who knew me as a little girl, they all said the same thing. Oh, you were a bundle of joy, just a ray of sunshine. But I wasn't a ray of sunshine. I had a storm raging inside of me that I was powerless to, and that storm eventually destroyed everything in its path, including me. So when that storm hit and leveled my life, the thought of processing grief I wasn't even aware that I had wasn't even on my list. Yes, I was determined to achieve and maintain sobriety. I just didn't realize that grieving and mourning were going to play such a huge part of that process. So what are some other things that people grieve following trauma? Yearning for the lost person, their life before the trauma, safety and security, maybe their homes and their possessions if they lost something in a terrible storm. You know, the ability to exist in the world and not see it all as a dark, hateful place. People have to grieve those things. So what actually is the difference between grieving and mourning? Grieving is the internal meaning that we give to our personal experience of loss. Mourning is when you take that grief that you have on the inside and express it outside of yourself. And, you know, I've talked in the past about the 5 stages of grief and in our webinars before. But really quickly, I'll list them just in case we have somebody who wasn't here for the prior ones. But they're denial and bargaining, anger, depression, and acceptance. The secret to processing PTSD grief is to learn to mourn. There's this need to authentically mourn because we have this collision between the heart and the brain, kind of the left brain and the right brain. The heart is searching for connection and permanency, and the brain is acknowledging the loss and the separation. And to bring these two together, these important pieces of ourselves, we have to practice authentic mourning. That's how it happens. Authentic mourning is being consciously aware of the painful emotions of grief and then feeling safe to express them. So authentic mourning is anchored in making a conscious choice to allow yourself to mourn. And I think it's really crucial here to remember, and that in those times of darkness, darkness precedes light. And you need to seek that healing in order to have a healthy transformation of your being. So what does that really mean? Darkness precedes light. That means it's not going to be easy. There will be pain. There will be darkness. Here's the thing. Walking through that darkness is what will allow the light to eventually destroy it. There was a wound. The trauma created a wound, and it healed in its own way, most likely an unhealthy way. So food, alcohol, drugs, gambling, sex, whatever was the Band-Aid. And sobriety caused us to rip that Band-Aid off. And now we have to deal with the wound. Many people choose to grieve though and not mourn. And grieving doesn't require much effort on your part. I think we've all cried alone. We've all suffered in silence. So if you've done that, if you've cried alone, if you've suffered in silence, if you've been miserable and never opened your mouth to share it with anybody, then you've grieved. And we can't even control when we grieve. It hurts. And maybe we never show it to the world. It's all internal, and we don't have to express it or share it at all. People tend to gravitate toward this method because we live in a mourning avoidant culture. Think of times you've been mourning. Think of times you've been hurting. How many times have you heard someone say to you, and these are kind people, they mean the best, keep your chin up, put it behind you. Girl, let it go. Here's a really big one, and I think most of us are guilty of having said this at some point in our lives to someone. Oh, don't cry, it'll be okay. What all of these statements do is tell us to squelch our grief, and they completely stop any mourning that is starting to happen. People are uncomfortable with pain. They don't know how to deal with it, so they tell you to move on. As a result, as a society, we've learned to push our pain down, and it sits there unexpressed and it festers. And here's what we know without a doubt. If your words don't speak your pain, your behaviors will scream it. So instead of sitting with our pain and allowing ourselves to mourn, we try desperately not to lose it and to maintain some level of control. And what sits right under control is fear. And what's right under fear is pain. No one enjoys the grieving process. And many times people avoid people who are grieving, and that makes it hard. That makes people not want to show their grief because they don't want to be isolated in addition to hurting. But having the courage to grieve and to mourn and to encourage others to do the same in your presence breathes life back into a broken heart. The process of grief is necessary to move on, and especially from trauma. If you don't fully express and embrace the emotions of grief, the loss remains alive and real. So what is that? That means it's constantly happening. If it's alive and real in your brain because you haven't been able to process it yet, then your brain interprets it as it's still happening. And when you consider this, you can begin to see how significant it is to be able to grieve and mourn in order to effectively begin the healing process from PTSD. Because when you don't grieve and you don't mourn, all those PTSD symptoms, they're alive in your brain, because your brain will perceive the trauma as actively happening over and over. Traumatic losses live in the mind and the body and the soul, and they live in there as shock and denial. And that contributes to the many hypervigilant symptoms of trauma. Trauma profoundly changes the way someone sees themselves, the world they live in, and who they are in that world. Unfortunately, many people have a trauma timeline in their minds. Who I was before the trauma, then there's the trauma, and now this is who I am after. This is what I'm left with. The change that trauma created in their lives is saddening and depressing because a true loss of life perspective has taken place. And grieving and mourning can shift that perspective. Grief is our internal response, but what integrates and helps us release that pain and move toward healing is to find safe people and places that allow us to mourn. But how do we do that? I love this guy, Dr. Alan Wolfert. He's a grief expert, and he says that there are 6 needs in mourning. And following these steps will help you transform grief slowly and at your own pace. First, you have to acknowledge the reality of the loss. You have to be able to say, this happened. And what that does is kick denial and bargaining right out the door. It's facing the facts as they are, not how you wish they would be, not how you wish you could have behaved, but exactly how they are right now, accepting the reality of that loss. The second thing he says is you have to befriend the pain. A key aspect of PTSD is avoidance. However, the mourning process requires you to acknowledge and interact with the pain. And then a third one is shifting the relationship. And this one applies both to if you've lost a person or if you're grieving something from trauma, because at the core of grief is something you might not expect, and that's love. So while you shift your connection to the past, you have to take steps to honor what you loved about what has been removed from your life. So obviously, that's easy to think of when you think of a person. You know, I was a grief therapist at hospice for several years. And one thing that people who are grieving the loss of a person do on a regular basis is they don't want to speak about the person. So many family members would tell me, oh, Kelley, I can't talk about my mom because if I talk about my mom, then my dad starts to cry. Or if I talk about my grandma, then my mom starts to cry. So none of us mention them. And what's that doing? That's repressing the grief. It's repressing the mourning process. It's okay if you cry. It's okay to have everybody in the room cry and get it out. You know, that's why people will honor someone and have a chair for them at a holiday dinner, someone they've lost. You know, the way I look at that is the people we've loved and lost, they deserve our tears. Isn't that what love is about? I mean, I would rather cry because I loved that person and had the privilege of having them in my life than to have never known them. And so that's mourning, when you're able to say, I'm going to talk about my mom, even if it makes me cry. How many times have you said, oh, I'm not going to talk about that, I'll cry. But you're pushing that down, and that's where it all goes wrong. And to give an example of that with trauma, I saw this world-class cyclist on television last week, and he'd had some terrible accident and ended up in a wheelchair. And in his home, he had all the pictures and all the trophies of him riding his bike and all of these things. And he said, I'm not, they asked him, did this hurt you to have all these things around you? And he said, I'm not taking all these things down. He said, there's no way I'm taking this stuff down. He said, I loved riding my bike and I want to keep those memories alive. He said, I'm not trying to live in that past, but it's something I loved. And I'm not going to just pack it all away because I can't do it anymore. So that is what an example of is for shifting the relationship. And, you know, some people find that hard to do with trauma, you know, but it's about the perspective and being able to shift it. And then the fourth thing is developing a new self-identity. PTSD recovery requires that you create the new you. You have to explore and figure out who you are in the context of everything that's happened. You're a different person. People are changed forever by trauma, but it doesn't have to mean that it's a negative change. The event may have been negative, but you can heal and move forward, and figuring out who that new person is is a crucial part of healing and of mourning. And then the fifth thing he says is to search for meaning. We make sense of our world by assigning meaning to what happens in it. And identifying what this loss means to you is crucial to your recovery. And finding a healthy and supportive circle of friends and people to be around, that is crucial as well, because that's the sixth step, having ongoing support. Because processing those feelings of loss takes time, and having continual support is critical to that healing. It can take weeks, it could take months. In my case, it took years. I had years and years of trauma that had been pushed down. And what are some other ways that we mourn? We talk about it. It's okay if you cry, like I said before, whether you're discussing trauma or someone you lost, talk about it. Let yourself cry. Express those thoughts and feelings. Some people express those things through art and music. People journal, they pray, they celebrate special anniversary dates. And those are just a few of the things that you can do that involve mourning. It's that open exposure, the sharing. Some people call mourning grief gone public. And I get that statement. I kind of don't like it, because to mourn doesn't mean you have to do it in front of everybody. It's about doing it for you. So whether you're journaling or you're praying or you're drawing a picture about it, you're expressing it. So it doesn't mean you have to do it in front of the whole world. It just means that you're getting it out in some way. People get tattoos. That's mourning. And so the thing is, this is super important, because if the normal grief process that we go through is interrupted, that is when you develop complicated or traumatic grief. And we're going to talk about that next time. But the thing that I think is so crucial to remember for today is that, as bizarre as it sounds, the lost and the found really are contained in the same place. The answer to healing is found in the very place that you lost yourself. And doing that open expression of it, that permission to grieve, is so important. This isn't a religious discussion, but if you look at the Bible, when anything bad happened in the Bible, when someone died and when the people got the news, or when they saw what had happened, they tore their clothes. And that was an open expression of grief. So if somebody was walking around and their clothes were torn, and people knew, that means he's mourning. There are still religions today that do that. The Jewish religion does that still today. I have a Jewish friend, and she has a pin with a piece of ripped cloth on it. And when her father died, she wore that on her clothes every day to work. And so, think if the whole world were to somehow adopt a way of being able to say, I'm mourning. I mean, look how differently we would look at everybody. We would, if we saw somebody having a bad day at the store, but we saw their clothes were ripped, or whatever the sign would be, how much more compassion would we have if we knew, that person's lost somebody? And yet we don't do that. And we're probably never going to do that as a society, as the whole world. And because we see mourning as weakness, we see grieving as weakness. When you look at employers, funeral time is 3 days, 3 days off. You've lost a member of your family, and your funeral time is 3 days. And so the grieving in the United States especially is so disrespected. And so that makes it a hard part of recovery, because if you say, well, I'm grieving and I'm mourning, people are like, but we have to be able to say, whether you understand it or not, this is the process I have to go through. And when we don't, like I said before, our behaviors will scream. They will scream, I'm not a healthy person. Or we'll keep running to the things that we're trying to stay away from. And, we don't want to compromise sobriety. We don't want to go back to things that hurt us as much as what we were running from. And so part of that process is not just grieving, but mourning. So I think you have to sit back and you have to be able to ask yourself, did I grieve this? And then you have to say, and did I mourn it? and take a long look at yourself with that process. You know, when I came home from treatment and was dealing with all of the repressed sexual abuse and all of that pain, I can remember sitting actually right here and just really crying and saying, you know, I didn't have a good childhood. And, you know, as much as I knew I was loved in some facets and by certain people, absolutely, I knew I was loved. I still had a darkness that destroyed my childhood. And being able to stop making, you know, excuses, being able to stop rationalizing, oh yeah, everything was fine. Everything wasn't fine. And it was hard for me to be able to say that, to say, no, like this happened in my life and I have to accept it to be able to move forward from it. And so that is where grieving and mourning came in. And that's really what the Lost and Found box is all about. You can find yourself, but you're not going to be able to do it by trying to tiptoe around the things that hurt. And healing isn't easy. I say that all the time. Healing isn't for the weak because it's painful and it takes a lot of courage to try to defeat the demons that tried to destroy you in the first place. So that's the difference between grieving and mourning. And that's what we have to all put into place to keep our journey going forward. So I don't know.
Great stuff. No, that was great
Yeah, what
stuff.
are you?
So like I had so much, like my mind is a buzz. So for those of you that are joining us, if you have any questions, there's a Q&A at the bottom of the screen. Please throw them in there. But you know, like the young boy was actively digging. He was, you know, and I was thinking that's what we have to be willing to do, is we have to be actively willing to find, you know. And I had a situation like, and I really think that's so true that kids, you know, just go, oh, it's me, or have to normalize, or, you know, put things into perspective. So you know, and the adults are, so you to the outside world were like, oh, you're a child of joy, and, you know, look, you're a ray of sunshine and all of those things. And, you know, on the inside, you know, the pain, and so then, oh, it has to be me. And if I can't trust the adults, then it, you know, there's something wrong with me. And that's so typical, but so painful. You talked about neglect. And neglect isn't just child protective services coming in, although when there's, you know, high level, I mean, when there's abuse, sexual or, you know, physical or whatever, then child protective services should be called in. But even just the, you know, like the parents are mentally ill, addicts, distracted. I was talking to somebody, they were one of 10 children. There just isn't bandwidth, you know, in a family that size, you know, for probably everybody getting all of their needs met. So there's so many different forms of neglect, and to be able to honor, you know, like, yes, that was neglect for me, you know, and it doesn't mean my parents were bad. It doesn't, I mean, it's just one of those things where everybody's doing the best they can, but it's still, you know, giving myself permission. I so agree with you with our culture in particular being really poor about, you know, oh, first of all, we want to stay away from people. Oh, you know, I don't know what to say to them. So, you know, so if you need anything, you just let me know. Well, like they don't even know what they need, you know? So like, you know, being intentional about, you know, how, you know, like I'm going to help you, I'm going to, whatever it is, you know, is helpful. So earlier this year, there was something, and I was like, I need to mourn this. So I looked up online and I gave myself a 13-day period of time. And for 13 days, I wore black, you know,
Oh, yeah.
and I was very intent, like, and putting on the black shirt every morning, like, was like, I was very intentional about it. And that kept me present, but it also kept me knowing that I was in mourning over this particular situation. It wasn't even a person, you know, it wasn't that I lost a person. So the other day, this week, I wore a black shirt and my daughter goes, "What are you mourning?" Like she automatically assumed that now I'm in mourning again because I wore a black
Yeah.
shirt. But I thought, well, you know, good for you for asking, like knowing that, you know, like that was meaningful to me. And it really helped me, you know, I gave myself permission, just like I gave myself permission to be, to experience the sadness and the unfairness and whatever, and all the things that, you know, were happening around that particular situation. And that wasn't even in the loss of a person. I mean, you know, so it is overlooked. And I think anything that we don't address, we stuff. and then, you know, it festers, and then, you know, it and I would much, as you said too, I would much rather mourn the loss of somebody that was meaningful to me than not having had them in my life. You know, those are like the hurt. I'll take the hurt because I got the joy. You know, like the bicyclist you're talking about too. He's got all these great memories. He can look at a picture and think about, oh, I was, you know, in the Italian Alps, or whatever he was doing. You know, he's got the memories of, and the exhilaration of that, and you know how awesome and amazing it is. You know, you're talking about grandma and stuff, like I had these visions of, you know, long dead, but you know, my grandma's, and like meaningful things of that. Well, great. I have to mourn their losses, but I also had, you know, grandparents who loved me. So it is. I mean, there are several grief groups on intherooms.com that I refer people to regularly, because I think so many people don't do that well, and it's a missing component. And getting support to go through grief, whatever it is for you. I mean, you know, it doesn't have to be. I mean, I tell couples all the time, you know, that are struggling with these issues, you know, the infidelity. I mean, you grieve the loss of the relationship you thought you had, that you could have had, of the couple that you had hoped for. I mean, that will never ever be, you know. So grieving that loss and going, how do we find a new path forward? So that's the, you know, and now I'm this new person, we're this new couple, eyes wide open. How do we do that? And just ignoring it and going, well, I'm going to put that up on the shelf and we're going to, you know, we're going to move on.
Doesn't work. Yeah, you know, and
No.
you talked about neglect. I think neglect is so tricky because neglect, there's no wound for neglect, and there's no scars for neglect. And so people are walking around and they're in pain, and especially children. And unless it's something overt, you know, a child can go to school every day and have clean clothes on, and that doesn't mean that they're not neglected at home. And so it's such a painful one for children. And it's also a hard one as they get older to say that their grief is real, because people tend to minimize. And if they say, well, I really have PTSD because I was neglected, unless you really understand that, most people are going to minimize that and put it somewhere, you know, that it doesn't deserve to be. And so, yeah, I think it's just so crucial to look at someone else's pain. And, you know, what I found is the people that I work with through my life coaching and different things, they don't want to hear me tell them, you should do this. Those aren't the two words they want to hear. They want to hear someone say, me too. Like, it may not be exactly what they've been through, but I've experienced pain. And so I know how it feels to feel like I'm never going to get out of this darkness. And, you know, I've said it a million times, I'll keep saying it. For anyone who feels trapped in that darkness, I promise if you look around, you'll see my footprints. And if I can get out, I know Tammy's footprints are there.
Yes.
If we can get out, you can get out. And that's a really, really crucial thing to remember, because I think that people think healing is just sitting around and singing Kumbaya. And it isn't. It's such hard work, and it's painful and excruciating sometimes, because you're going through things and sorting through things that were incredibly painful. And there's no way that's not going to hurt. And people say, well, I'm reliving it twice. Like, it means I was traumatized twice. And it may feel that way, but it's what you have to do to be able to move forward.
Yeah, and I think for me, like when I remember this one, I mean, like the most painful crying. I mean, it was just this mass, like I just uncontrollable, you know, gut wrenching sobbing, most cleansing, most freeing, to be able to let go of that. All of that was in me, and it would have stayed in me. Like the pain was in me, you know, and the cleansing that came, you know, with the crying. But, you know, as a society, first of all, if you're female and you cry, you know, it's like, oh, you're just a, you know, typical female. And if you're a male and you cry, you know, how weak are you? You know, so not understanding that, you know, that, I mean, we have tears for a reason. I mean, like they, you know, so we have a couple of questions. I have been dealing with a betrayal trauma and in the last year of overwhelming systemic racism. How do I heal? I do have a group and therapist for betrayal trauma, but I've got no support for the emotional eating. As a woman of color, how do I face all of this pain from all over? I don't feel safe to share with others who are not like me. Women of color have eating disorders too.
You better check out.
Men, everybody's, I mean, like, I can't, there's all, I mean,
Yeah.
eating disorders are not just a white
No,
and female thing.
no.
So,
And, this is exactly what we deal with every week in the Binge Free Babes. People think that because it's named the Binge Free Babes, it's just about binging. It's not. It's about all emotional eating. And, we say in there every week that it's not what you're eating, it's what's eating at you. And so I'm so sorry that you've dealt with that, and that you've dealt with not only the betrayal trauma, but then the racism that goes along with that is just absolutely absurd for her to have experienced or felt. But when you don't, like you said, how do you face all of the pain from all over and you don't feel safe to share with others? Yeah, absolutely. It's so difficult when you feel that you're in a storm that no one else has experienced who's like you. And but there are so many eating disorder groups out there, and especially because of COVID, so many groups that have, just a very diverse panel. We have people from all over the world. We have people from London and everywhere. And but it's difficult because I think with the betrayal trauma, then you want to feel like you fit, and that's where you're like, I can't find anybody who's like me to make me feel like I fit. And um, so, it's just so much different pain and different layers. There's so many layers of different trauma here. And, you know, she says she's dealing with the betrayal trauma, but no support for the emotional eating. Yeah, I can definitely, I don't know if you like to read, but my co-founder of the Binge Free Babes, Dr. Nina, she has a book, and the title of it is The Binge Cure. And it's like, I forget how many steps. I was looking to see if I had it out here, but it's however many steps to outsmart emotional eating. And, it's a really, really powerful book that helps you, that doesn't help you find a group that is full of people who are like you. And, but I think you have to start somewhere. And maybe you could find a group that was an incredibly welcoming group. I can't speak on any other groups except the group that we have, but our group is very welcoming, and it has a private Facebook group, and it's only women, and the women in there just support each other like crazy all day long. They're active in this group, and they really support each other through. We've had several deaths and different things happen, and these people just have each other's back. They get fighting mad when someone hurts one of them. And so I don't know any groups that are specific cultures or races. We have like I said, a divided, oh my goodness, diverse group. I want to say divide. And so, of course, everybody has eating disorders, just like everybody has addiction. Everybody, nobody misses out on that. There's no race or culture that doesn't experience certain things, even if people think that, it's just ignorance. And so
and maybe you can go to a group and find one person, like maybe you go to the group and you get group support, but then you find one person. We have that often, like with our betrayed partner groups and things like that, where, people go, oh, let's connect outside so we go to the groups, but then they connect outside, as continued support. So there are other people, and I'm so sorry that you're struggling on so many levels, but like, you chose to be here today. Yay. Like, like a lot of it is just like choosing the next right thing, so I chose to do this. I'm going to choose to do a group. I'm going to, because all of that other stuff is out of control. So an eating disorder is part of like a control thing. So I'm going to have control over this or whatever. So how can you make a decision that will that you'll feel good about? Hopefully you're glad you're here. And can you find one person, not even a whole group of 1,000 people, but is there one other person that you feel like, gosh, this person gets me? I have to believe that there is, because I know too many people that are in a very similar situation. So so hopefully that helps. There's a betrayed partner group today at 12:30 Pacific time on sexandrelationshiphealing.com. So join that, but like I just find that these issues, run through, some people may not be talking about it, but like I know too many partners who have talked about, my eating has been out of control because of the stress. I get it. I get it, so.
I was 400 pounds, but I didn't binge.
Yeah.
But I didn't, but I was an emotional eater.
Yeah.
So, the name of our group is a little bit, could be misleading. It's just about emotional eating. That's just the name of it. But absolutely. I was 400 pounds because food was my comfort. Food was the one thing that was always there for me. Food didn't let me down. And so, yeah.
And food for me absolutely could numb me, just like alcohol and drugs could. Like I knew I could use it to numb out. So okay, next question. For many years I thought I was the problem why my SA was acting out. It really affected my self-esteem and confidence. It's been 3 years and I'm really trying to find myself again. How do I allow myself to heal and to find the old me? I was a sexual being before, I think, and I have not been for over 3 years. So my first thought was, you're not going to find the old you. You're going to find the new you. So so grieving the loss of the old you, which was, I always talk about with couples, like you won't be the same person that naively believed that your partner was going to be there for you, because that your partner can actually betray you. So it's finding what is the new you, and the new you has resilience that the old you wouldn't have known about, didn't so I think you're going to find you absolutely have to give yourself permission to understand that the SA's problems, that's a broken person who, I'm not making excuses. The addiction, the acting out is absolutely because they didn't know how to cope with the world and everything else. So it's a maladaptive coping mechanism. So not okay, still problematic, but it isn't you. And you carrying the burden for the SA, it just hurts, hurts me that it hurts you. So
I just wanted to say, it's part of that where I spoke about people have a trauma timeline, and we want to avoid the trauma timeline, where it says me before the trauma, then the trauma, and me after the trauma. Like, we don't want to have that. And that, like, her betrayal was a trauma. The betrayal was a trauma. And so she has this timeline where she has her trauma and she's trying to get back to that me before the trauma. And we have to get rid of that timeline to be able to say, I'm going to transform into something I've never been before, something better, because that person, trauma changes people. And, there's nothing that can be done to change the fact that it changes people, because you've been through something devastating. And so you're going to come out of it a different person. Healing lets you come out a better person. And and I know the steps to healing that are so many and so complex, but, being able to forgive yourself for the sins you didn't commit. And I don't even, by sins, I'm not trying to push religion on somebody, but I mean, a lot of times we take on, especially when we have healing to do, we take on somebody else's poor behavior. And we try to come up with like you said, you thought it was, you were the problem. And so being able to say, this wasn't me, this wasn't about me. And I was okay, I'm still okay. But I'm going to move forward and be who I am today. And so I think that's crucial in your healing, is to be able to let go of the fact that you could have done anything to make it be any different.
Yeah, and it's hard for partners to not think that if they've done something differently, if they and unfortunately the messages, I mean, I've had people that have come to me and said that the therapist said, well, if you address sexy or do whatever, I mean, like, you
Yeah,
can
in
tell
my
how I
book,
feel about that. Yeah, so
yeah,
it's one of
my
those
book,
things
I
where,
talk about, I talk about the man cheating on me because I wasn't the size he wanted, so I thought, well, if I can just lose weight, then he'll, won't cheat on me anymore. And it had nothing to do with me. It had nothing to do with my size.
yes,
It just
it,
didn't.
yeah, but it's an easy way to point the fingers out rather than it being about the addict. So I share this often, there's nothing you could do or not do that is going to make somebody act out. They always have a choice. If they're unhappy, if they're unhappy that you gained 50 pounds, they could say, well, let's go for, I'm concerned about your health. Let's go for a walk. Let's do healthy eating together, whatever. But, like having an affair or whatever is not okay. If it's like, I don't like that that we aren't feeling close. I mean, like it's called communication. There are ways of navigating relationships that don't involve somebody, acting out sexually, or drinking or whatever they're doing, whatever form of addiction. So it really, it, the good news is it's not about you. The
Yeah,
bad news is it still really, has tremendous, and it's betrayal trauma. We talk about betrayal trauma. So all the things that Kelley was just talking about, trauma, 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 so finding the space to give yourself permission to heal, absolutely.
I think too, like just to follow up with one thing about that, when we, it's sort of an example of that identification with the aggressor. When we think it's something about us and we have hope of it changing. If we say this is their issue, then nothing we do can change it. And it's either deal with this or don't deal with it. But as long as we think, well, it's this, then there's still hope that our situation will change.
Somebody put a question in the chat. How can I find an effective way to mourn that does not include talking or talk therapy? So, I mean, Kelley gave some ideas like journaling. Like I told you, I wore black shirts for I looked it up for 13 days. Somebody said, "Hey, where did you find it?" I said, Google 13 days. Cause I was like, I actually was going to, because I know the Jewish religion has a more, I mean, they sit Shiva, they have a far more honoring process, but I just looked it up and I saw something that said 13 days. I thought I can do that, and so giving myself permission, being intentional. I mean, I was really reflective during that time that, I was experiencing a lot, I had experienced a loss, and that I was giving myself permission to move through that. I didn't minimize it. I was like, this is what it is. But so when Kelley was not able to join us the first Wednesday in April, Harriet Hunter joined us, and she talked about journaling. And there's so much research that talks about how journaling is very healing. And so that video is on sexandrelationshiphealing.com. Under the resources tab, you'll find all of the previously recorded, including Kelley's that she kind of referenced before as well. But there are many ways that don't have to be, just therapy or talk therapy or whatever, but honors the loss, but honors also the process. So thoughts?
Yeah, no, I think you said it perfect.
Okay. There's a whole bunch of stuff in the chat, but it looks like it's just comments. So, okay. Anybody else have any questions? Throw them in the Q&A. We're happy to address them. So, but
Yeah, I think, people think that it does mean it has to be something like therapy or something in that regard, but you can do it. And I know one of my life coaching people made a little garden of flowers in her
mm,
backyard and put a little bench out there, and she said that's where she planted all of her mom's favorite flowers. And she said that's just where I sit with her and I talk to her, and sometimes I cry. She's like, my kids know, like, oh, she said sometimes, she said, my daughter comes out and just sits down and cries with me. And I'm like, oh my God, this is beautiful mourning, but it gives everybody permission to mourn. And think about it. I'm sure, Tammy, at some point in your life, you've said to a friend or to somebody, oh, don't cry. It'll be okay. And I just said last night at an event that the only time we should tell people not to cry is if they're getting ready to do some big event and they're happy tears and they don't want to destroy their makeup, because, and I am doing that next time. I have all these options instead of telling somebody don't cry. And because that's what they really, really need to hear.
Somebody that lost a spouse said the most helpful thing was somebody, a good friend, because all the other platitudes didn't, but this friend came up and sat down and said, I can't even pretend to know what you're going through. Just know that I'm here for you. And just sat there, like you were just talking about with a bench, just sat there and just was with. And I was like, wow, and I have kept that because I don't want to be the platitudes person. And unfortunately, when I've heard too many times the Christian, oh, God needed another angel or whatever. And I thought, well, it feels minimizing to me that, your grief, I just, it's challenging for me. So just being willing to hold the space for, someone, and like, I can't even imagine, but yeah. I'm here.
And, my son, when he was just little, my mom lived next door, and, kids get it so much more than we do. Being a hospice counselor for so many years, people would say, I don't know what to say to people at funerals. There's nothing you can say. Just say, I'm sorry. There are no magic words. We don't walk in with this like secret language that heals somebody, because it just doesn't happen. But anyway, one of my relatives was sitting on my mom's front porch and had gone through a bad divorce, and he was actually sitting out there crying, and our yards were fenced in together. My son was only 5. And I said, Alec, where's Thor? I said, that was our dog. I said, I can't find him. And he looked out his bedroom window, and I just thought this was a beautiful example of this. Our dog was sitting on my mom's front porch with this relative of ours, and he said, he's out there helping Uncle Kirk cry. And I just thought that was so beautiful. Like,
yes,
that he's helping Uncle Kirk cry. And I just thought, oh my gosh, like, this kid gets it,
Kids and pets, they get it. Yeah. We adults, not so much. So, okay, so there's another question. When is the right time to address childhood issues when one discovers spouse is an SA? And I lean towards the prodependence versus codependent therapeutic approach to working through SA, betrayal, and trauma. So I'm glad, because there is no such thing as codependence. It's, it's not a thing. And prodependence isn't a label, it's a lens. So glad your Dr. Rob just finished the book with Rutledge that will be in universities and things too. So it just went to the publisher a week ago. Yay, that was a thing. So
yeah, codependence is beautiful. The right time to address childhood issues, I think as soon as you're aware of them.
I think so. We do trauma-informed therapy, a treatment at our treatment center. So it is a challenge, because like diving into the trauma when someone doesn't have the support resources, if they haven't stopped the behavior, that's not the right time, because like all of that is just going to be so triggering and things. So we do trauma-informed therapy. So we're dealing with little bits of it, but honestly, like some of those things, like it will be years of layers, so like, oh, I can handle this layer now, and then have more recovery, and then something else comes up. I had something a couple years ago that came up, and it was like I went and did some EMDR with my wonderful therapist, because I was this is an issue. I could not have identified that, the 10 years before. So I think it's always a process. But as things are coming up, of course they, need to be dealt with rather than shoving them on the closet shelf. So
Yeah, and that's what I meant. Like with me, when I went into treatment, we didn't dive into the sexual abuse. We had to deal with what was presenting and what was, we couldn't, there was so much in my life. We could have never dealt with all of it at one time. I did disclose, which was huge in treatment, but we had, like you said, to take it layer by layer by layer in the right time frame. I just think, yeah, I think though, like you said, okay, we're aware this exists, and then you have to work with your treatment person to, discover when the plan is and what the right time is based on
yeah.
how the approach you're using.
Yeah, and like like I said, so in our treatment center, I know, because I've talked to our clinical director, and she's like, somebody was like in a traumatic state, so they would do EMDR on that particular issue in the moment, and then move on. But it wasn't like, okay, now we're going to do trauma therapy,
Yeah.
So it really it's. And I don't want this to sound like, oh my gosh, this is forever. Well, it kind of is. This is a journey. So it's one of those things where, like, you're not going to get there. But the opportunities along the way to, like the issue that I mentioned that came up a few years ago, I have not struggled with that issue since then. What a gift. So I'm glad that the time came that I was able to address it, and I don't have to carry that burden anymore, but that's been my experience. So
yeah, there's no finish line to healing.
right.
Yeah.
Right. Yeah. Is there a disadvantage risk in working with childhood or adult trauma with a therapist that's not EMDR certified? Well, there's somatic experience. I haven't tried brain spotting, but I'm like, it's on my list. But I'm gonna go try it now. But so EMDR is just one form of trauma therapy. I think doing trauma work with somebody who isn't specifically trained to do trauma work, that would make me nervous, because it's like with a sex addiction specialist, like when we're dealing with this stuff, working with a general therapist, I say, is like going to your GP doctor for specialized cancer treatment. You really do want the person who's going to be able to best guide you and help you have a good outcome. So, and as far as certified, like some of them are in process and working with a supervisor and things too. So I be an informed consumer. How's that?
I would say, like Tammy said, there are multiple approaches to treating childhood trauma, and EMDR doesn't have to be what you use. I would be really careful of someone who said, I'm doing EMDR and I'm not certified and not underneath a super.
Or not trained, right?
Yeah,
or
right.
in training. Yeah.
If somebody just says, oh yeah, I can do that too. Like that'd be, yeah.
How hard can it be? You just do some tapping, so.
Yeah.
We just, yeah. So
Yeah.
no, like this is, somebody said once, doing mental health stuff, like you go to the doctor and you broke your arm, they do an x-ray, they know what they're doing, they can see what they're doing, you get blood work done, they see what's going on. This is that one area where like they don't do, like they can't see what they're working on. So, it really does take the skill to unpack, the issues that are presenting. So, but
I would certainly say, if there are infinite ways to find your own way. So, just because you have childhood trauma doesn't mean you have to go to a therapist that does that, whatever you're comfortable with. Like I said, there are many, many, many approaches and whatever you're comfortable with. I would just, like Tammy said, be careful.
yeah. And if it's one of those, it's a journey. So if you go, oh, I've tried some EMDR and that was mildly helpful with this, but I need to go do, I mean, I have recommended and fortunately had good results with, there are people that spend a couple days with a client who are, are really cocooning them and giving them intense trauma help, but they're at the point where they're able to take that in. So there's some resources that are being posted. Adult children of alcoholics, that many people are fit that category. Survivors of Incest Anonymous, SIA. So in this day and age, you can Google lots of resources. Many of those are also on sexandrelationshiphealing.com. Under the resources, you'll see lots of various 12-step and other support groups as well. So we are out of time. So thank you. It was so great to see you again.
Thank you for being so understanding and patient with me.
There's life. So yeah. But anyway, all right. Thanks everybody. See you next week. So next week, Kristen Snowden will be here for the Wednesday series. So see you then. Bye-bye.
Bye.